In this lecture, we will discuss the P wave, specifically what it represents and how it should normally appear on the EKG. The P wave represents the first positive or negative deflection in the start of the cardiac cycle. If you look here, we have our P wave situated here, okay? The beginning of our cardiac cycle, right here, is where our P wave is. It represents atrial depolarization and begins when the sinus node or neighboring atrial pacemakers fire. Okay, so if you see here, we have our first positive or negative deflection, the start of the cardiac cycle, and it represents atrial depolarization. We're saying it begins when the sinus node fires. Remember, our sinus node is right here, or it can start when we have another atrial pacemaker, okay, an atrial rhythm starting here, and it will also be represented by a P wave, okay? Now it includes the impulse transmission through the internodal pathways, through the Bachmann bundle in the atrial myocytes, okay? So again, just to review our conduction system, this is our sinus node. Then we have our internodal pathways, these here. There's an anterior, middle, and posterior one. They come to our AV node, coming to this left side over here. This is what we call our Bachmann's bundle, okay? So that's the Bachmann's bundle, depolarizing the left side. And then from our AV node, we have the His bundle. The His bundle splits into the bundle branches. We have our right bundle branch that innervates the right ventricle. Then we have the left bundle branch that splits off into a left anterior fascicle and a left posterior fascicle, both innervating the ventricle. Okay, the left posterior fascicle innervates the inferior and posterior parts of the left ventricle. The left anterior fascicle innervates the anterior and superior portions of the left ventricle. So let's just clear this up again. And what we're saying here is that the P wave representing atrial depolarization, so we're looking at everything above the ventricles, okay? That's where our P wave represents, and it's depolarizing this area here, okay? And it also includes that transmission through the Bachmann bundle and the atrial myocytes. Now the impulse of the transmission, let's just erase this here, goes from the right atrium to the interatrial septum and then to the left atrium, okay? So remember, we're starting here in the sinus node, so we have this initial portion of the right atrium depolarizing first, okay, that vector, and then it starts to spread leftward through this interatrial septum, and then this left atrium then depolarizes, okay? Now in terms of the P wave morphology, how it appears, it has a smooth contour, okay, notice the smoothness of that P wave, and it's monophasic in lead 2 and biphasic in lead V1, okay? Why is it monophasic in V2? We'll notice that we have one vector heading this way and the other heading this way, the second one, okay? But the mean electrical axis is pretty much heading in this direction. Notice where this arrow is heading. So this would be 0 degrees, this is positive 90, okay? This would be lead 1, lead AVF, okay? And then we have lead 2 sitting here at positive 60 degrees. The mean axis that you'll see with the P wave is between 0 degrees and positive 75 degrees, so somewhere in between here. And because it's heading towards lead 2, that's why we see those upright P waves in sinus rhythm, okay? And we said it's biphasic in lead V1. Remember, V1 is one of our anterior precordial leads, okay? So imagine V1 being here. We have the wave heading first towards V1, okay? So you'll see a positive deflection, all right, and then the left atrium depolarizes, and it does head posteriorly away from V1, and because of that, it will be downward deflection. And we call this a biphasic P wave, okay, and you'll see those in lead V1. The initial portion of that biphasic P wave representing the right atrium, and the latter terminal portion representing the left atrium. Now we said the P wave in the frontal plane, this is our frontal plane that we looked at here, is between 0 and positive 75 degrees, so in this region here, and is directed leftward and inferiorly. We said the initial portion of the P wave represents the upper right atrium being depolarized, okay, and because of that, it's heading anteriorly. So if we erase some of this here, okay, let's just erase so we can make some room. All right, so again, the first vector is heading this way anteriorly towards V1, okay, and that's why we see that upright P wave in V1, and then that terminal P wave represents left atrial depolarization as well as the inferior portions of the right atrium being depolarized, and it heads posteriorly, okay? So away from V1, and that's why we see that negative terminal portion in V1. Now we should see upright P waves in leads 1, 2, AVF, V4 through V6. So why is that, okay? So imagine our P wave axis. Okay, let's erase some of this here. We said our arrow here in red is our P wave axis between 0 and positive 75 degrees. This is where the positive end of lead 1 sits. Lead AVF is down here, lead 2 here, and then we have lead 3 on this side, okay? And we're saying that it should be upright and positive in 1. That should make sense. It's going towards, right, 1. It's going towards 2, AVF, another inferior lead, okay? And then we have V4, V5, and V6. So imagine on our horizontal plane, we have V4 here, V5, and V6, okay? So it should be upright in those leads as well. And then it should be inverted in AVR. And why is that? Well, we have a depolarization wave heading this way, and AVR is here, okay? So it's heading away from it. That's why we see an inverted P wave in lead AVR during sinus rhythm. In all the other leads, it could be variable, okay? It could either be isoelectric, positive or negative, or even biphasic. Now, the normal P wave duration is 0.08 to 0.11 seconds, okay? Or 80 to 110 milliseconds. So what do we mean by the duration? So imagine we have a complex here, this being our P wave, our QRS complex, and this is our T wave. We're talking about the P wave duration, so that means from the onset of it to the end of it should be between 80 and 110 milliseconds, okay? So that's about 2 to 3 small boxes, okay? So that's the normal duration. Now the P wave amplitude, so the height of it in the limb leads, okay? Remember the limb leads were at 1, 2, 3 AVR, AVL, and AVF should be less than 2.5, okay? So if you erase some of this so we can just show it again. So here's our amplitude in the limb leads. This should be less than 2.5 millimeters. It's different in the precordial leads, okay? And this depends. Remember we said in V1 we can have a biphasic P wave, so imagine something like this. The first positive component, okay, of that biphasic P wave should be less than 1.5. So that part should be less than 1.5 millimeters. The negative component, this portion here, should be less than 1 millimeter, okay? Remember, 1.5 millimeters is 0.15 millivolts, and 1 millimeter is 0.1 millivolts, okay? And the reason we want them less than that is because if they're greater than that, we can have P wave abnormalities where we can see atrial enlargement and so forth, okay? So some of these P wave abnormalities, the best leads to look for them are in leads 2, 3, AVF, and V1, okay? Those are the best leads to look for them because that's where the P waves are the most prominent. Hopefully this is starting to make sense. So review this material, make sure you know it, because when we start looking at different rhythms and atrial abnormalities, you'll notice changes occurring in the P wave, okay? And that's how you'll be able to tell what's going on. All right, let's briefly review what we discussed before we end here. So again, the P wave represents atrial depolarization, okay? Atrial depolarization, and this is our P wave, all right? And it's the first positive or negative deflection in the start of our cardiac cycle. It begins when the sinus node fires, okay, normally, if we are in a sinus rhythm, or you can have it when a neighboring atrial pacemaker, something from in here, gets excited and fires, and that would set off a P wave, but with a different morphology, okay, and we'll talk about that later when we get into rhythms. Now it includes the impulse transmission through those internodal pathways. So let's just erase this. So the internodal pathways, these here, includes that in the Bachmann bundle, okay, and as well as through the atriomyocytes. So all these myocytes within the atria are being depolarized. So the whole atrium. Think of everything above this plane representing the P wave. And the impulse transmission that we see, notice it's starting from the right atrium and then moving leftwards, okay? So why is that? Because the sinus node is in our right atrium. So right atrium starts first, and then it starts to head this way towards our left atrium. Okay, so that's the pathway. And that's why we said the initial portion of our P waves represents the right atrium, and the latter portion represents the left atrium, okay? And because of that, we'll learn when we get into atrial abnormalities, if we see a problem with the right atrium, it will increase in amplitude, and if we see a problem with the left atrium, it will increase in duration, okay? So hopefully that makes sense. Now, when we talked about the morphology, we said it's usually smooth contour, monophasic, or biphasic. Usually monophasic in lead 2, right, as it heads towards that. And then V1 that sits here, it's biphasic as it moves anteriorly towards that lead, and then posteriorly to depolarize the left atrium is where you see that biphasic P wave occurring. Remember, the P wave axis is normally between 0 degrees and positive 75 degrees, leftward and inferiorly directed. The initial P wave, we said, is from upper right atrial depolarization and is directed anteriorly, right, towards V1. The terminal P wave is where we have the inferior right atrium wall being depolarized as well as the left atrium. And this one is directed posteriorly away from lead V1. Okay, and then because of this, we will see upright P waves in 1, 2 AVF. Okay, here's 1, 2, and AVF as that's heading towards it. And we'll see also upright P waves in V4, V5, and V6, okay, when we're in sinus rhythm. We'll see a negative P wave as it heads away from lead AVR, okay? So just think of the axis, everything heading in this direction, okay? And superimpose this red arrow here in that direction. So that's where the normal depolarization wave is heading. In all other leads, you'll see a variable, could be upright, inverted, or biphasic. Now the P wave duration, normally it's between 80 and 110 milliseconds. We talked about the amplitude in the limb leads and precordial leads, it's different. Limb leads being less than 2.5 millimeters, okay? So if you look at lead 2, one of the main ones we'll look at, all right, for any atrial abnormalities, we want it less than 2.5 millimeters in amplitude. The precordial leads, when we look at the components, the positive component should be less than 1.5 millimeters, and the negative component should be less than 1 millimeters, okay? And remember, when you're looking for these P wave abnormalities, the best leads to look at are leads 2, 3, AVF, and V1, because that's where they are the most prominent, okay? And just think of it, here's lead 2, here's lead AVF, right? V4, V5, and V6, and V1, okay? This is our right atrium, so everything heading in that direction, and that's why we look at those leads too, all right? Here's AVR heading away from it, and where we would see the negative or inverted P wave. Well, that's the end of this lecture. We discussed the P wave, specifically what it represents, and how it should normally appear on the EKG. I hope you learned something.